Welcome to Eastern State Penitentiary Historic Site and to our Searchlight program. I'm Sean Kelly. I'm joined today by Ming and Chester Hollman III from the Pennsylvania Institutional Law Project. Welcome to you both. It's wonderful to have you. Thanks for taking the time tonight.
For having us.
We're going to be talking about their new animated film titled Living in Prison During COVID-19. It is beautiful and incorporates the voices of currently incarcerated Pennsylvanians. It's a really extraordinary piece of work. And we're going to be watching chunks of that film and discussing aspects of those experiences as we go through. Before we get started in earnest, I want to tell you a little bit more about Eastern State Penitentiary. This is the Searchlight series. This is the first Tuesday of every month. It's always live, often here from Eastern State Penitentiary, where I am tonight, from 6 to 7 p.m. Next month, on April 6th, Impact Justice has just released a report called Ending the Hidden Punishment of Food in Prison, and we're going to be talking to them about that report. COVID does come up quite a bit, but they were working on this before COVID as well. It's going to be fascinating. Please join us in 1 month. Eastern State Penitentiary itself is an ancient prison on farmland outside of Philadelphia. It's pushing 200 years old these days. It was built on farmland. It survived all the way until 1971 when it finally closed and has this distinctive radial floor plan. Today it is a museum. We give tours to school kids. We give tours to many, many tourists to Philadelphia and other folks who want to see what the inside of an ancient prison looks like. We host artist installations. This is Deonzo Rogers' piece called #Black Girlhood about the criminalization of aspects of Black girlhood in America. In 2014, we built this called the Big Graph. It's an infographic sculpture that shows the rates of incarceration in US history and how they have skyrocketed in this era of mass incarceration. And they show how the racial disparities that were present throughout all periods of incarceration in this country have actually grown worse, again, during this period of mass incarceration that we're living through now. That's part of every tour of Eastern State. If you come to Eastern State, it'll be part of your experience. We built a companion exhibit called Prisons Today, Questions in the Age of Mass Incarceration, that asks questions about the general nature of criminality and why the United States has to, or we believe we have to anyway, incarcerate so many more people than any other nation in the world. We have, during the pandemic, many of our programs have gone virtual. And so we have a program called Prisons and the Pandemic. It's a 3-minute news roundup of all the COVID-19 stories of the week as they impact incarcerated Americans. You can see it on our Facebook page, so I encourage you to watch that. We are proud fair chance employers. In fact, we have a job opening right now for someone in the management team of our education department. The job is only available to someone who can bring the experience of incarceration to our team and help us think about how to discuss incarceration with that perspective. If you know someone who's formerly incarcerated and has great leadership skills, please send them our way. We just posted this job on Friday. We're very excited to expand our team. We are reopening to the public on March 12th. We're closed right now because of COVID, but we're getting ready to reopen. So please come and visit us at Eastern State Penitentiary. If you like what we do, if you want to become a member of Eastern State, which is one of the ways we keep these programs free, please join us as a member, find a way to support us. This is my shameless plug to support Eastern State Penitentiary Historic Site. You can find us in all the classic standard places, Facebook, Twitter, Instagram, so forth. Our guests tonight are from the Pennsylvania Institutional Law Project. I'm going to forego the introductions and allow you to introduce yourselves, but welcome so much. We want to talk about your film. Actually, before we even get to introductions, let's watch a little bit of this film, if that's all right. I'm going to show about the first 90 seconds, then we'll open it up to a discussion about why you made the film and what the challenges were and what we can be taking from it. So here's the first 90 seconds of the film by the Pennsylvania Institutional Law Project.
COVID-19 has impacted all of us, but people who are incarcerated are experiencing a dramatic change in their living conditions and safety during this pandemic. Prisons and jails are hotspots of COVID-19 in the United States. The fact is, if you're living in prison during this pandemic, you're at a higher risk of getting COVID-19. Life in prison is group living. You have meals and recreation together and share common areas. You are unable to socially distance on your housing block or in your cell, or you may live in an open dorm. Staying 6 feet apart is often impossible. Dozens of people enter and leave prison every day, increasing the chance that you will come in contact with someone who has been exposed.
One of my major concerns is being in the day room. The day room is just a room with bars in it. There's no windows, there's no doors to protect us from people that are coming into the prison. If someone walks into this prison with COVID-19, they will have to walk past us. And if they were to cough or sneeze or anything like that, they would literally be affecting this whole entire room.
I feel unsafe because we're in very congested areas because of the cell size and the population. The density of the population is a real problem. So we're basically sitting ducks.
That is such a powerful testimony. We're going to watch sections of the film throughout the hour tonight. We're not going to watch the whole thing. Our team is putting the link to the film in the chat, or in the comment section on Facebook, so you can watch this yourself. I really encourage you to watch the whole film. So Ming, can you tell us, what is the Pennsylvania Institutional Law Project and why is it necessary? And I believe you are the CEO or the executive director. I'm sorry, I should know your title.
Yes, I'm Ming Ye. I go by Ming as my first name, and I'm the executive director of the Pennsylvania Institutional Law Project. We are a statewide legal aid agency where we seek to advance the constitutional and civil rights of people who are incarcerated and detained in Pennsylvania. So we provide legal assistance, advocacy, and litigation on behalf of people who are incarcerated and detained, basically seeking to ensure humane conditions, that people are treated fairly and justly in prison. So we are statewide, and we basically provide legal help to people who need it.
I think a lot of our audience would believe that people who are incarcerated have rights to free legal counsel. Why is your organization necessary?
It is so important to have legal representation when your rights have been violated, but you have no right to a lawyer in the civil context. You have a right to a lawyer in the criminal law context, but not if you get assaulted in prison, if you have trouble getting medical care, if you have unsanitary, inhumane conditions of confinement. You actually do not have a right to a lawyer. So thousands of people have to litigate these cases, bring these cases by themselves. Your chances of success are going to be much higher. The reality is if you have a lawyer. So we are here to both provide legal help as people navigate cases on their own, but importantly, we also represent people. And sometimes we are one of the few organizations in a particular county or in a location that provides that legal help. And we might be the ones who are pushing back on prison policies or practices that really are harming people who are incarcerated.
That's really impressive. We know a little bit about your work because we work in similar fields, and it's wonderful to have you on the show finally. Chester, your voice sounds familiar. Aside from the beautiful voiceover work you did narrating the film, we're going to hear your voice throughout the evening. Can you tell us a little bit more about your role at Pennsylvania Institutional Law Project?
Yeah, I work as a legal assistant there. I've been there approaching a year after spending quite a bit of time incarcerated. It's like a project, assuming you said that just basically allows those who are incarcerated to have, I guess, like you said, representation where needed. Because a lot of things that happen in prison where, we just don't have those resources, and this institutional law project gives us that outlet to pursue these avenues of, receiving compensation or even receiving a better treatment in these institutions. So, it's a job that, I hold dear, and I'm grateful to be there. And, Ming brought me in, and, it's been an experience that, I can't even put into words, because after spending so many years in prison, and, I was actually one who wrote to the Institutional Law Project many years ago seeking their help. Now to find myself working there, it's just real, so.
Oh, that is such a lovely little moment it comes full circle, that you're able to provide the help to others. Yes. That you sought yourself. And
Yes.
we don't need to dwell on this, but your case is pretty well known that you were also exonerated from those charges. And so I think
Yes.
it's worth mentioning that. I don't want to ask you to if you're not comfortable with this question, Chester, of course, just let me know. But I was curious if narrating this film and hearing the voices of people who are from the inside brought up any memories, or what was that like to be narrating this film and to be spending time with this subject matter after your personal experience?
Well, when Sue Ming first approached me, my first thought was to me to say yes, because like I said, she's a great person. So, naturally I wanted to say yes. Like I said, I wanted to take some time to think about it because like I said, I'm so close to it and the situation and being incarcerated and understanding, what these guys are going through in there. And like I sat back and, it was my opportunity to give back and to be a voice on the outside of those on the inside and understanding what they're going through. So it was a no-brainer after that. And, narrating and reading and listening to the voices of the guys inside, it gets you emotional. I was very emotional going through the process, but at the same time, it was necessary. This is something that has to be, put out there for people to understand that, this is a serious topic. And, not does it only affect us on here on the outside, but more so those on the inside, because like I said, they are so, congested and confined to these small spaces that they're more likely to, attract over opposed to, the movement and the freedom that we have out here. And I just thought the work was very important. And, it was a no-brainer after that.
Oh, that's great. And you said you've been there for about a year. So
Yeah, almost a year, almost approaching a year.
You'll have to have a little celebration for your anniversary.
Yeah, yeah.
I'd love to show, speaking of the voices of the people from the inside, I want to show one more clip. I also want to remind the audience at home that you can ask questions on Facebook by putting it in the comment section. And here on Zoom, you can put in the Q&A section. We'll be gathering questions throughout the hour. We're reserving the last 15 minutes for questions from the audience. So please just send them in whenever they occur to you, and we'll do our best to get to them all. We're going to play another clip here. And give me one moment. I'm going to have to jump to a different, sorry. I might need one moment just to, give me one moment. Sorry. This is the hazards of doing this by myself here.
Many incarcerated people are medically vulnerable to severe illness or death from COVID-19 due to their age or a chronic medical condition such as heart disease, diabetes, or COPD.
That's a little clip that I thought I'd be able to do this a little better than this. Forgive me, folks. I'm going to jump. I have this set up here. Thank you for bearing with me. Now this is ready.
In prison, you have little control of your living environment. You depend on the prison administration and staff to take the correct actions to protect you. However, the responses of prisons and jails to the pandemic varies dramatically. Some prisons have even failed to test individuals for COVID-19 when they have symptoms.
As far as the unit itself, the cell doors, there's no barrier on the bars, so anybody that's walking in or offered a unit, there's no real social distancing. Also, the staff, some wear masks, some don't. Some have it around their neck. There's not real stringent requirements as far as wearing the mask. And as far as the ventilation, there's a passive ventilation system, so there's no real good ventilation. If I go into the day room and come out and then they bring another cohort group in, we're passing each other, we're going into the same areas. As far as social distancing, that's basically non-existent.
Sorry for that awkwardness coming in there. This film is so beautifully made. It's just so, the content's so disturbing, but the craft of it is so lovely, and the storytelling is so powerful. Can you tell us about the origins of the film, why you wanted to make it? I guess assuming it might make sense for you to start with.
Yeah, so about a year ago when the pandemic started, I was immediately concerned, and all of the staff were very concerned about the people who are incarcerated, what this meant for them. We all heard about congregate living situations being extremely dangerous relating to COVID-19. So we started to hear from people. People were nervous, anxious, and then we heard that people didn't have access to basic things like soap, cleaning supplies, masks. And we heard some prisons were not social distancing, while some others were using these severe lockdowns. One immediate effect was that visits were cut out. So people who were incarcerated became extremely isolated. It was very difficult to get information from them, and they had difficulty getting information about COVID-19. So this project emerged from that, thinking we could use it as an educational video to show families and friends of people who are incarcerated. They could then pass on that information as needed. It grew then into also a way to highlight the actual experiences of people who are incarcerated. As time passed, we realized that was vitally important to really shine a light on what people were experiencing and the really abysmal conditions that people had to suffer through during the pandemic. So we fortunately got some funding from the Pennsylvania Legal Aid Network to do this. We are not in the business of making videos, so it was definitely a learning curve for us. I had a great team, Sierra Shamer, Alexander Morgan Kurtz, and then Ben Bowens joined us. They are lawyers and paralegals. Ben is a communications professional, but we were just doing this, but we were able to get two fantastic professionals, Loroto Productions and Emily Yu, who's an animator, who just really made this what it is. And then Chester, I have to give a shout out. I mean, he's not a professional narrator, but from my eye, you wouldn't know from hearing this. Like, I just felt like his voice just lended such a powerful tone to the film that, I'm really appreciative to all who worked on it.
You want to add anything to that, Chester?
Thank you.
Why animation?
Well, for a few reasons. One is obviously during COVID-19. I mean, the thought of having to film things in person seemed overly daunting, especially roughly a year ago. You remember we were, had all these restrictions. You weren't allowed to leave your home. So there was that end. Then the reality is, could we even film in prison? I mean, the assumption was probably no. So we thought of animation as a way to illustrate the points that we can make in light of all the different challenges. And it gives us a little bit of creative license to portray what we think is important. Some of those graphics are based on real photographs and real images of prisons that we have either toured or been to as part of our cases.
I have to give a shout out to our team who put together animated films here called Hidden Lives Illuminated. I was hoping we'd find time to show one of our films about the impact of healthcare, lack of healthcare inside of prisons, but I don't think we're going to have time. But all that by way of saying that we've done animation with people who are incarcerated within our organization. And hats off, we were watching this and just so impressed because we know how difficult and time consuming and demanding animation is. Can you say a few more words about the animator? You mentioned her name a moment ago.
It's Emily Yu.
And how did you come to the project and just a little bit about her background or what?
Well, I will say that I was not so involved. There are a few people who looked at a variety of animators. I did look at a few of them. We thought the animation was just really wonderful, would fit our ideas well. So we reached out and she joined us. She's based in California, actually. So the benefits of remote work and COVID is that you end up being able to work with people across the country.
Yeah. Okay. Well, let's watch another clip. You mentioned a moment ago the severe lockdowns that are happening in prisons all across the country. This is something that regular viewers of Searchlight know that comes up a lot, that people who are incarcerated in this country are almost universally living in severe lockdown right this minute. And so I thought your film did a particularly good job of explaining what that might feel like. And so I'm going to share my screen here and we'll watch about another 90 seconds of the film and come back and talk about it. So here we go.
Many prisons are now under severe lockdowns, which may violate the constitutional rights of those inside, limiting their access to resources and endangering their physical and mental health.
We're isolated at least about 22 or 23 hours a day. And we come out almost combined, we come out nearly an hour or so a day. So now, not only you're only going to the yard for a couple times a week for 1 hour, but your movement is very restricted. It feels like you're like a chicken in a chicken coop, and you have no place to walk around or whatever.
Although it's a stressful situation, he's trying to maximize that hour, because that 60 minutes goes very quickly. And what he tries to do is he tries to get a phone call in because, as I stated, the lines to get to the phone are so long. The phone call is only 15 minutes. He has 45 minutes to do anything else that he needs to do. But usually his first priority is to try to get a call into me.
Prior to COVID-19 lockdown, we were allowed to have visits 4 or 5 times a month, in-person visits. But since the COVID lockdown, we are able to get what they call video visits now. The quality is so bad that you can barely really have conversations with your family.
I feel terrible cutting these sections off because they're so powerful. The voices of the incarcerated people that you interview are so powerful. Were there any challenges of trying to gather those voices as you produce the piece?
Yes. Well, we thought about clients of ours or people we've been in touch with through the years and who might be willing to speak with us on this project, because there's a certain amount of risk, to put yourself out there and talk about these issues. Fortunately, we had 3 people who were willing to step up and participate, as well as a mother of an incarcerated person. And then we just had to navigate the technical difficulties, which luckily we had, as I said, professionals dealing with that end to conduct those interviews by phone. But we were very grateful for them being willing to be interviewed for this project.
Yeah, I was wondering did you withhold their identities for privacy purposes or because of fear of retribution, or both?
Primarily for the fear of retribution and retaliation. We know that retaliation is very real. So we were afraid that by their identities being known, that they might face some sort of backlash, either by the prisons or otherwise. So that's the main reason. And a little bit of privacy as well, of course. But we did have people from all systems participate, whether it's federal, state, county. So that's not that obvious, but we were pleased with that.
Just as an aside, that's actually a question that's already come in through our chat here in Zoom. Someone asked if you work in the federal and the county prisons as well. So you work in all 3 levels of prisons in Pennsylvania.
That's correct. So we will represent and help people who are in federal prison, county jail, state prisons, immigration detention centers, halfway houses. So basically, if you are in a location where you cannot leave of your own volition, then you qualify for our services.
And there must be similar organizations in other states. Is it common that every state has an organization like yours, or is Pennsylvania unusual and lucky to have an advocate like your organization, representing voices that might otherwise struggle for legal counsel?
Yeah, unfortunately, we are unusual, and we're unusual in a couple. There are a lot of states who do have fantastic lawyers and organizations who do work, but we're not, our kind of organization is not in every state. And the other thing that is special about us, I think, is that we're also a legal aid agency. So we do have a mission and a responsibility to help everyone who seeks help in some way. Unfortunately, we can't represent everyone in court because these types of cases are unfortunately very time consuming and honestly resource intensive, which means they also cost a bunch of money. They take a lot of time, but we try to do something for everyone, whether it's a response or information manuals. And we do our best to respond to everyone because we think that's just incredibly important.
I saw some very impressive numbers on your website for the number of people you serve in a given year. Can you tell us a little bit more just about the scale of your outreach or your ability to support people who are incarcerated?
Yeah, so we serve thousands of people every year, and each year we get roughly 15,000 letters requesting help in some form. I think in our Philadelphia Department of Prisons case right now, we've established a hotline and we get legal mail. We've talked to at least 1,000 people in that prison system, either talked or written to 1,000 people from that prison system. We are statewide, and we're, with our small staff that we have, we do what we can to reach as many people that we can.
And you're headquartered here in Philadelphia, I gather.
Yes.
Chester, are you part of the team that responds to those letters and those calls?
Yes, I'm more so like when guys looking for manuals and so forth, I respond to those, and we get those out as quickly as we can. With the pandemic, things have kind of slowed down, but we're still moving. And like I said, whether it's manuals or case law, to help these guys, further their own cause, looking for some type of assistance in that manner. I do my best to try to get it to them as fast as I can.
And I should note that our 3 offices are in Philadelphia, Lewisburg, and Pittsburgh. So we have some division related to that. So someone can write to any one of our offices, which is on our website, www.pailp.org, and you can get our address there. And then if needed, we have our own internal system to send it to the right person to respond if needed. But we do have 3 offices. Sometimes that's helpful for people if they're on the west side or, in the middle, they might want to contact that office.
And getting back to the clip that we just heard, the voice of the mother was so powerful, and the way that Zoom formats things you might have missed, but that long, elegant line eventually turns into a phone receiver at the very end. My screen anyway was buried under my photograph, but it's such a lovely and upsetting image. How often do you work with the families? Is that a common thing, that you're dealing with someone who struggles to communicate directly, and so they're communicating to you through their families? Is that a common?
It is very common for family members to contact us. They might make the initial contact either through calling or emailing, or now sometimes through social media. Ultimately, because we are, at the end of the day, a nonprofit law firm, we do need to make contact with the individual, but families all the time contact us. And we completely understand that. So it can be very difficult for people to have access to the outside.
And final question is about the organization. We'll get back to the film. This all sounds very expensive. Who pays for all this work?
We are fortunate to receive funding through the Pennsylvania Legal Aid Network, which comes in a variety of sources. But I will say that individual donations are really crucial and vital, and we're so grateful to people. Some of those donations from our everyday people are what funds our most innovative work. So we're just always very grateful for people who are willing to step up and support us.
That's great.
And there are other ways to support us other side from financially. I also want to just note, putting a plug for our organizations. We do have a website and social media, so we encourage people to follow us that way.
Well, as long as we're on the subject, I was going to ask you later, but why don't you we're already here. Just give us a quick plug for other ways that we could support your work. You said on your website, and Nicole put the website in the chat. So if those of you watching, the website is right there. What are other ways that people could support your work, Ming?
Yeah, so the one way is just to educate yourself on the issues. So this is not just supporting us as an organization, but supporting incarcerated people overall. So educating yourself about the different issues, advocating on behalf of incarcerated people, and I think bringing lawsuits is incredibly powerful, but there are also sometimes limits to that. So the voices of everyone in the community advocating is incredibly important. And then coming to our website, following us on social media, whether it's Facebook, Twitter, Instagram, and then, as I mentioned before, supporting us financially is just incredibly helpful as well.
That's great. Anything to add to that, Chester?
Listen, Ming said it all. That's exactly why she's the director.
All right. Okay. I'll make sure to give you a chance to chime in if you want.
Okay.
On that note, I'm going to go back to the film. There's a section of the film where you outline very clearly the actions that you think that prisons should take. Well, there's a mixture of things that they're required to do that you remind us, and then also some common sense things that they should be doing. And I thought I'd play that. This clip runs a little longer than the others. This is about 2.5 minutes of this clip. So let's take a look. We're back to the film, and here we go. Oh no. Oh, wouldn't you know it? Let's see here. Sorry, folks. Stop.
Prisons should regularly provide masks, soap, cleaning.
I apologize. Back this up a quarter of a second and take it from the top.
To totally losing his eyesight.
Prisons should regularly provide masks, soap, cleaning supplies, and keep clean common areas. They should enforce social distancing, but they should do this humanely, which they can do by limiting the size of groups when people come out of their cells. Prisons should monitor the symptoms of their population and staff. They should also conduct regular testing. Unfortunately, if prisons don't take proper precautions, incarcerated people do get COVID-19, and those who become sick with COVID-19 struggle to receive medical care.
I believe I became exposed to COVID-19 due to the fact of me being put in a tank with inmates that were coming from the streets that didn't have previous tests done. During the time of me being sick, I didn't receive any medical care whatsoever. There were several times I believe that when I threw up, there was like a pinkish color in my vomit, so I assumed that it might have been blood. I tried to get their attention and call medical, but they have a procedure where when they call medical for something that's going on with your body, it's not a guarantee that they'll respond, because they might be handing out medication, or they might just like they don't have to respond right then and there because my situation isn't serious, I'm not dying, they feel like. So it was a lot of times where I was neglected, where I tried to get medical attention.
When you are in prison, you still have certain constitutional rights: to be free from cruel and unusual punishment, to have safe and humane conditions when incarcerated. These constitutional protections do not vanish even in an emergency situation, such as the COVID-19 pandemic. In many ways, these protections are even more important now that life in prisons is under great restriction. While in prison, your living space should be clean and sanitary. You should also be able to maintain personal hygiene with regular access to showers, clean clothes, and bed linens. You should not be subjected to long periods of time in lockdown, confined to your cell, and you should be allowed some type of regular out-of-cell recreation. You have a right to personal safety and protection from violence, both from other incarcerated people and from prison staff. Even during...
I'll leave it there. Do you find that people often misunderstand the rights of people who are incarcerated? Is that a common... I gather from the film you thought this was important information that's misunderstood. Tell us more about that.
Yeah, so I think that, especially in the beginning of the COVID pandemic, I think not all prisons knew what they were supposed to be doing. And part of this is, you might remember there was a lot of information we didn't know necessarily as the way we do now. So we thought it was incredibly important to make sure that prisons knew that. So one thing we did was, at the very start, back in March, we sent a letter in collaboration with two other organizations, ACLU and FAM, sent a letter to every single county jail, the State Department of Corrections, each federal prison in Pennsylvania, and immigration detention centers about using science and evidence-based procedures to keep people safe and healthy during COVID-19 and the people who are incarcerated. So based on the complaints we've gotten from clients, I would say not everyone knows what they're supposed to be doing. And we hope that this can help educate people.
Your film points out that healthcare was already a crisis inside of correctional institutions before this. Can you say a little bit more about that? And I don't want to put you on the spot, Chester, but if you want to, as someone here, I've never been incarcerated, I always try to point that out, but as someone who's witnessed this from the inside, if you're comfortable answering that question, I'm curious people might think that this is a new problem, but in fact, we have a whole series of programming here at Eastern State pointing out that this has been happening in prisons forever, whether it was typhoid or tuberculosis or HIV or the Spanish flu, that people who are incarcerated in these tight spaces are generation after generation on the front lines of the first people and the first and the worst impacted of these diseases. Can you say a little bit more about that, Chester, if you're comfortable?
I mean, I was mean, the healthcare in prison, I mean, it is what it is. I mean, you get the bare minimum. During my time in prison, I'm thankful that, I didn't, succumb to any severe illness, but, when one gets it, we all get it, something that's as small as a cold, and with the healthcare there during the time that I was there, the medical department, I mean, I think they give you just enough to keep you going. The main thing was Motrin, Tylenol, everything, no matter what happened, it was always Motrin or Tylenol. And if it was anything more severe, you kind of had to file a grievance or push the issue on the medical department to get them to treat you. And, so I know for me and a lot of guys that I knew in there, we just tried to maintain our health, by working out, doing the things that we needed to do to stay healthy and not have to actually go to the medical. It's a shame, the way things are, but at the same time, I know, majority of society believes that those are incarcerated, whatever they get, that's what they deserve. But at the end of the day, we're still human beings, and regardless of why they're there, as long as there's life, there's some decency and a sense of humanity has to be, given to these people. And and like I said, I spent 28 years in there, and falsely accused, and as we're seeing, not everyone in prison is guilty. Some there are there innocent, and there's others who are there by whether guilty or by no fault of their own, but nevertheless it's just an environment that like I said, you just don't want to have to deal with the health department, so to speak, medical in prison. Like I said, that was always a concern. I know for me, I can only speak for myself, and I know a lot of guys I can probably speak for, but I'm gonna speak for myself. That was a major concern throughout my time, was making sure that I felt clean and I maintained my my physical strength, because like I said, you didn't want to have to go to medical because you knew what you were going to get. There was a time where medical was free, and then I guess with budget and so forth with the state, they started charging us for medical, and we were paying, I believe it was $5 per visit, whatever it was, and then if you needed medication, it was an additional $5. So it would top off at $10 potentially. For guys who aren't getting any money from home, and you're getting idle pay, which is from from the state, you only get about $16. So if you're going to medical, you're losing $10. It leaves you with $6 left to buy soap and whatever else you may need. And for those who had support from the outside, it was a little easier. But at the same time, being charged, if I go up there and said I had runny nose, it's $5. If I want the medication, it's another $5. And naturally, you need the medication. So either way, they're going to get their money. And like I said, if you didn't have it, you would just go into the red. So whatever money you had coming in, it would deduct as soon as it landed in the books. And so a lot of us, we just try to maintain our health so we didn't have to deal with medical. And and I can only imagine now during the pandemic, we were worried about catching a cold in there or catching the flu. So now with the pandemic, something like this as the pandemic, I can only imagine. And I made it out 5 months before or 6 months before the pandemic hit. So I feel very fortunate, but at the same time, it's a lot of guys that I know that are still there, and I'm in contact with them, and at this point, a lot of guys are just scared because they're not receiving the information, about this pandemic. You feel for them. I mean, it's not about being sympathetic, but it's about being empathetic, and just having empathy for, another human being, regardless of why they're there. And I think that's the most difficult part. And I can only imagine now, with knowing how medical was during time prior to the pandemic, I can only imagine how it is now.
Thank you so much for sharing that perspective. It's really, really helpful. I'm going to show one more final clip, and it's an upsetting topic. It's where the film talks about the institutionalized racism present inside of prisons. The stories told here are very explicit. I wonder, before we watch this, if you could put it in context. Are these the types of claims that you hear on a regular basis? Is this something that is a common theme? Or is this something that felt that you wanted to highlight it because it felt distinct to this moment?
Since the first day I started working at the Institutional Law Project, we have heard complaints from clients about racist incidents that have happened, whether it's hate speech, acts. I remember one time someone talked about a noose being hung outside their cell. And unfortunately, legally, it can be very, very hard to challenge these things. So obviously with the, after George Floyd and the racial justice uprising, we felt it was vitally important to highlight these issues and give voice to what's happening and to name it. So we very consciously wanted to make sure we address this issue, which I think, as the person says, our client, the incarcerated person says, really became even more enhanced during a lockdown situation during the pandemic. So we just thought it was important to include it, and we were pleased that we were able to address the issue in a film that's really about COVID, but of course, no issues are standalone, if you will.
Right, absolutely. And we thought it was important too, so we're going to play the clip. A quick reminder to the audience, when we come back, we're going to take questions from the audience. So I'll leave those for us now, and this runs about 1 minute and 30 seconds. And it's a little upsetting. Here we go.
The devastating impact of COVID-19 on incarcerated people of color hits harder due to the systemic racism and the mass incarceration of a disproportionate number of Black and Latinx people.
The racism that goes on in here, and the racism is very deep, and they never deal with it. And now that we're under COVID-19, it's like more in your face than before, because prior to COVID-19, like I had said, you moving around a lot, and so you don't have a lot of interactions probably like with guards. Under COVID-19, however, we have too much interaction with guards. We have plain white masks, no colors, no symbols, no nothing on it. But they are allowed to come in the prisons, and they coming in with these different masks. And so a lot of them is coming in with like this patriot stuff, red, white, and blue masks. And some of them have messages on them. One person, they had monkeys on them. So you got that going on. And that's something that nobody never talk about, really. You don't never really hear about racism in prison.
Further, there is fear that these restrictions will continue even after the pandemic ends.
And the measures that they're doing, it seems to be more about control than anything. Security and control. It doesn't seem to be about health and safety. Some of the ways that they use to restrict our movement, they're going to try to keep. And in fact, they've been bragging about it. They've been walking around was like, yeah, this is going to be the new normal. This is how it's going to always be. Basically, they want us to be locked down almost 24/7. That's how they want prison to be, like a maximum security lockdown, solitary confinement institution.
So Ming, Chester, do you think that this is going to be the new normal? Do you think that's the intention, and do you think that's likely to happen? We hear that from let me stop my screen. We hear that a lot from people in our network who are incarcerated, the belief that this is going to be the new normal. Is that what you believe?
I hope it's not the new normal, but we don't know what will happen. And I think this is the time where advocacy and litigation, but the voices of everyone, is really important to emphasize that this should not be the new normal.
I mean, and as far as what I think, I don't think anything's ever going to go back to the way it was, especially in prison or out here. Things have changed, and we've kind of adapted to this way of life, particularly in prison. I'm thinking that it made it a lot easier for the staff, not having to deal with, some of the violence that goes on at times. It's easy to manage. So I'm quite sure they'll probably try to implement some things that will keep things along these lines, but at the same time, can't keep guys locked in 23 hours a day, letting them out hour. So I can't see that necessarily being the norm, but I'm quite sure there's some changes that are going to be made, and it's not going to be in the benefit of,
Yeah, and I should note that we've seen some slight modifications. In the beginning, it was just extreme lockdowns. People were getting maybe 15 minutes, 45 minutes. We got reports from multiple people across the state that they were in their cells for days, which means, days on end, which means that they didn't get to shower or call anyone. I think in recognition of the real imposition and the harm it can create on people's mental and physical health, these sort of solitary confinement conditions. We do have one case, our Philadelphia COVID class action lawsuit, where the judge has ordered a minimum of, now it should be 3 hours out a day, which does make a difference. Although I will still note that's still 21 hours in your cell. I think the long-term consequences could be devastating, especially when you're talking about people who eventually, for the most part, are coming home. And so what does that mean for our community? So I think overall, we really have to do what we can to ensure that people are treated humanely, have time out of their cell, have access to recreation and educational opportunities, all of that while they're incarcerated.
We have a ton of questions coming in on social media. The most common question, there's 5 or 6 people who have asked, can you share your contact information again? People obviously have loved ones who are in prison. Give us one more time the best way to get in touch with your organization, Pennsylvania Institutional Law Project.
Sure. So for all 3 addresses, they can go to our website, www.pailp.org. If they want to write to us, they can write to any of our offices, but the address for our Philadelphia office is 718 Arch Street, Suite 304 South, Philadelphia, Pennsylvania, 19106. And so that might be a way. If they want to call, our Philadelphia office number is 215-925-2966. And they can also reach us through other means, through messaging, and they can follow us on social media for more information as well.
And it's the Pennsylvania Institutional Law Project.
Correct.
Several people have asked, what is the state of the vaccine availability for people who are incarcerated and also for staff? I know it's not your exact area of expertise, but we have a bunch of questions and I bet you know the answers.
Yeah. Now I am perhaps cautiously optimistic that vaccines could help protect people who are incarcerated. What we have advocated is that people who are incarcerated get the vaccine at the same time as prison staff. And public health experts say that this is necessary, that this is one prison system. People should be vaccinated at the same time. And this also helps build trust in the vaccine. If people see staff getting it, then are incarcerated. As you know, there has been sort of a dark history of medical experimentation on people who have been incarcerated. So this would also help build trust in the vaccine. So thus far, there have been select prisons who have been able to administer certain doses of the vaccines. But as we all know, it's fairly limited overall. So how many doses have been given out have varied. I would say it's somewhat of a trickle to start, but it has been happening.
That's great. I'm curious myself why people who work in prisons aren't required to get the vaccine. I was talking to some colleagues who work in the state prison, and they were all saying they were really proud that all the staff in their facility were going to get their vaccines. And I was thinking, I'm really glad you're doing it. And they were going to do it very publicly. They're going to put it on the closed circuit TV or something and show that all the staff was getting it. And I thought that was great. And I was just also, my jaw kind of hit the floor, like, why aren't you required to get the vaccine? I would think that working with such a vulnerable population would be necessary. Is that not legally possible to require people to get vaccines?
It does get more complicated legally to mandate something, but it is feasible. So I would say vaccines are slightly different from testing. So we have advocated for mandatory testing of all prison staff because we know through studies and through CDC for public health studies that regular ongoing mass testing of prison staff and incarcerated people really helps combat the spread of COVID-19. Because basically you find out about it earlier on. We know it spreads through asymptomatic people. You find out who it is and then you can stop the spread. Vaccines are slightly different just because it's a vaccine. And right now, honestly, we don't have enough doses to go around to really make this a live question yet. So we've really focused on education and really talking about the benefits of the vaccine for everyone. So we shall see if we ever get to that point where, sometimes we might request that if someone's not vaccinated, that they be in a position where they don't have as much contact, like a non-contact position, for example. You're not maybe not on the cell block, but you're in administration or doing something else.
Yeah, that's a great answer. Thank you. It's very helpful. I've been curious about that myself. Several people are asking how this film will be used. Someone on social media asked, can it be shown to judges who are sentencing people? Someone else asked, can the people at the Department of Corrections be required to watch it? So several people asking, what's the future of this film? What is the future of the film?
So when we originally thought of the film project, the film was really geared towards the community members, people who are friends and families of incarcerated people. That was our initial goal, because we are kind of a we're a service provider, if you will. But we've also been trying to use it as an educational tool, going beyond that. So we have shown it here. We've gone on to different to different media or shows or either online or whatnot to try to talk about the film and the experiences that are highlighted in the film. As for having judges see it, I would love that. I don't know. I would have to think about how to get that done. I don't know if I have the power to do that. But we would love for people to share the film, encourage other people to watch it, spread the word, because we hope that I personally am proud of it, and I hope that others can learn from it too.
Yes, you could probably tell as I was sharing my screen. It's just on YouTube. So the link is in the chat, and you can find it there. But we obviously encourage everyone to share those. A couple more questions coming in from Facebook. Let's see. Sorry, one that was interesting here.
Just to note, while you're talking about that, if people want to share, it's also on our website. If they have a harder time getting on YouTube. Okay. They can share it that way.
Here's an attendee from Facebook. I have the sense that many PA prisons are in geographic areas with little diversity. Is that true? Is prison staff more diverse in the areas where they are located? Is it worth trying to advocate about this? Is that your experience that many of the prisons are in geographically remote areas?
Absolutely. Many prisons are in very far away locations. We talked earlier about how it's hard to get a lawyer. That's part of the reason. When you're to get to, Houtzdale or Canaan, USP Canaan, all of these are very far away. It takes hours to drive there. So you have to resort to other ways to stay in touch with people. And as you know, there's nothing like, of course, now none of us can do this really, but there's nothing like meeting and talking to someone in person to really understand their story, to be able to advocate for them. So the fact that these prisons are in far remote locations makes it all the more challenging. And in terms of diversity of the staff, so Pennsylvania being what it is, many of the prisons are located in areas that are more rural, and the communities are white predominantly. So the staff do tend to be white and less diverse. That changes slightly when you are looking at prisons in other locations, obviously, like in the urban areas or whatnot. But I've visited so many clients where there's a clear racial disparity between who is incarcerated, people of color, Black and Latinx people, and then the staff who are mostly white.
I don't want to paint with too broad of a brush, but I have been in the parking lot of a prison and seen a car with just completely in the staff parking lot decked out in Confederate bumper stickers. They literally had little flags all around. I know that's not every officer in Pennsylvania, but it's this one officer in Pennsylvania, and that was in the prison that's closest to the city. I've noticed this pattern that I'm sure you've seen as well, that the prison that is closest to the major city gets all the volunteers, all the university programs, all the do-gooders like me and the rest of our team here go to the one that's the closest. And so we've done a lot of work out of Chester. We've done a lot of work out of Phoenix here in our organization. The third furthest away prison, I don't even know where it is. And it must be that pattern that seems like those prisons seem like they're just in a whole different world. And there's a big state filled with was it 27 now prisons that we have in the state prisons? And so that question really spoke to me. We are running out of time. Is there any question you wish that I had asked that I didn't? Any final thoughts for us, Ming or Chester?
We're just really delighted that you've tuned in to join and watch us, and we hope you support both the Eastern State Penitentiary and the Pennsylvania Institutional Law Project. So thank you for coming today.
Thank you. And I know people have a wide range of thoughts on those who are incarcerated, but this film is is really helps to expose what goes on inside, and this is an important topic. I mean, it's not only affecting us out here, but more so the people inside. They are confined, and like I said, it's just about getting people to recognize and realize that these are human beings that are being affected by this pandemic, and so just to bring awareness and
And one thing about COVID-19 that is a little unusual is that because of the way COVID-19 spreads, what you do for incarcerated people also benefits prison staff and the community. I mean, this is, I think, generally the case, obviously, but COVID-19, it really brings that home. So we really should do our best to ensure that everyone is treated and given every opportunity to be healthy and safe during this pandemic.
Here, here. That's a great place to end it. I need to thank a couple of people. Damon McCool helped us prepare, helped write some of the questions for tonight. Thank you, Damon. Nicole Frankhauser is running the tech on our end. Ben on your team is wonderful. Ben was really easy to work with. Ben was great. And of course, our biggest thanks to Ming and Chester Hollman III, who have donated their speakers' fee back to Eastern State Penitentiaries. Very gracious of you. Thank you for being with us tonight.
Thank you, Sean. Thank you.
Work.
Thank you.
Okay, this is good night. Good night, everybody.
Good night.